Carrie, thanks. This is a particularly difficult year for people who suffer from seasonal allergies. With COVID-19 still out there, you may get some looks from people if you're coughing or sneezing.
Yeah, you know that feeling you have to explain yourself if you've sneezed?
Oh, it's not COVID.
It's just, yeah. Oh, man. So the weather is warmer, and Carly's been telling us the pollen counts are really high. A lot of people are miserable right now. So is it just our imagination? I don't think so. Dr. Desai from Kansas City University is here with some suggestions and tips. And so we'll start here, Dr. Desai. It is severe earlier this year than it maybe normally is, right? It's not just our imagination.
It is not your imagination. Since 1990 to 2018, there's been about a 21% increase in the concentration of pollen, and that's due to about 20 more days for those oak trees to grow. So there's been just a longer time for ragweed, oakweed, and other pollen-producing plants to grow as our planet gets a little bit warmer. So there's just higher concentrations everywhere.
This is a big one because there is an uptick in cases of COVID-19. We know that, but there are also a lot of allergens out there. So how do we know if this is allergies or COVID-19?
Yeah, it certainly can be a little bit of confusion there because there's a lot of overlap, between the two, especially if you've had your vaccines and you've had your booster. You might have a mild case of COVID and you might just wonder, is that allergies? So for allergies, you try and think more of sneezing, itchy eyes, watery eyes. And for COVID, it's a little bit more in the sense of if you have muscle aches, if you have fever, chills, nausea, vomiting, diarrhea, or any disturbance in your sense of smell or taste. And the good news is most of us have testing kits at home, but if you're not sure, you can always call your healthcare provider.
And we know we're hearing a lot of reports, people with asthma saying that this spring is more severe than they recall in years past. So what is the relationship between allergies and asthma, Dr. Desai?
Yeah, Pat. So usually, you have the upper airway, which is involved in allergies, and the lower airway, which is involved with asthma. But, now we think of it more as just one airway. So those same things that cause a reaction in the body for the nose, the eyes, and the throat can also cause that same reaction and set off, people's asthma. So asthma is definitely made worse by people who don't have allergies under control. So that's important to get that, under control, prevent those flares.
So a lot of people are popping their Zyrtex, their Allegras, whatever they're taking for their seasonal allergies. What else can people do to relieve some of these allergy symptoms if those antihistamines just aren't doing the trick completely?
Yeah, a lot of people say they get groggy on those meds or don't like taking them, but sometimes it's frustrating when you still have other symptoms. So one thing you can do is a physical barrier. So no one wants to hear this, but wearing a mask, especially in the mornings when those pollen counts are the highest, or if you're doing yard work, may help. Coming back inside and then taking off your hat and changing your clothes that might have gotten pollen on them is helpful. And you can even rinse that out of your nose. So you can use a saline nasal spray, just some puffs on each side. Or you can go a little step further and do like a neti pot or a saline rinse where you put in distilled, purified water on one nostril, then watch that water come out not as pure on the other side. And sometimes you get some pretty gross stuff out that side.
I'm sorry. Okay.
Yeah, if you've done the neti pot, then you know what the doctor's laying down there. But I do appreciate you talking about the masks for yard work, though, because I've always been an advocate of that. And
Really?
One of the weird offshoots of COVID now, people don't look at you so strange now when you're wearing a mask when you're doing yard work because, it's not an unusual thing anymore.
It's true.
But it has gotten worse. I will say, Dr. Desai, I went to college in Missouri in the early 90s. I moved back here in 2011, and I'm telling you, I don't know the science, but something is different.
A lot of our medical students come from different states, and the first fall here is sometimes a little bit brutal for them.
Yeah. I believe it. I remember that coming here for the first time and being like, I have allergies?
Right.
That's
exactly.
new.
I know.
So, all right, Dr. Desai, thank you.
Thank you both. Have a nice week.